When you get back home, the most important thing is for you to walk for exercise and rest and try and get good nutrition. Most people will be a little bit anemic. They'll lose a little bit of blood with the surgery. We try to minimize giving people transfusions, and most patients don't need a transfusion, but still they'll lose a little blood, so they'll be a little fatigued, and they need basically some time to just get over having the surgery. But usually it's not too bad, and people get up and get going and walking and start getting back to their activities and are feeling better because their severe pain that they had before surgery is gone. Our normal procedure is the day after surgery we get patients up in the chair and start therapy, which means walking. And I tell people, you know, I don't expect you to set the world on fire today, but we want you to get up and start moving, because it's important to minimize the risk of a blood clot, and it's good for your muscles. It's overall important for their recovery and their health. And I think psychologically it's also kind of a big boost that they know, okay, I can walk, I can move, I'm really on the road to recovery. The rehab after the hip surgery usually advances fairly quickly, because the most important exercise for patients to do is walk. And it's pretty easy for most patients to walk. They don't actually have to have a therapist there to help them do exercises. So we just want people to walk, walk, walk. And we start people off with a walker or crutches, depending on their age and their balance. If they have some balance problems, they need a walker. If they're a little younger, then crutches are usually easier and less inconvenient. But usually after a few weeks, they've gotten onto the cane, and then as soon as they feel comfortable, they go without the cane. In terms of driving, that's a very important question. What I tell patients is that they can drive their own car when they're walking with the cane and not taking narcotic medicine while they're driving. So for example, I say you get up in the morning, have some Tylenol with your breakfast, get in the car, go do your errands, you come back a couple hours later, you're tired, you're aching, you take some pain medicine, you're in for the rest of the day. But that time will expand to where the last narcotic pill that they take is at night, and so gradually the time during which they can drive expands. We want people to get back to their lifestyle and back being active just as soon as they can, so we encourage people to do those things. It's important that the patients with hip replacement surgeries be periodically checked by the orthopedic surgeon with an X-ray, because sometimes if the implant starts to wear or loosen, we can pick that up earlier on an X-ray. The patient won't feel that there's a problem that's developing. And then sometimes we can watch for a while, or sometimes we need to do an operation that would be a less invasive or less risky, less complicated operation than if we let the problem go on to become a bigger problem. So usually we'll check patients after the surgery, 3 months after, 1 year after, and then at 2 or 3 year intervals after that to periodically see them, check their X-ray. And so I can make sure they're doing okay. You're not going to be right back to where you were when you were 20 years old, but you're going to be a lot better than you were before, because if you're having your hip replaced, then you've got a worn out hip, and the hip replacement's going to be better than your worn out hip. But I try to educate my patients that it's not the same hip that they had when they were 20 years old. We're not nearly as talented as the Creator, and while these implants are great, it's not the same thing. So I do try to get them in line with a reasonable level of expectation, that they need to be careful with the hip, avoid running, jumping, and impact activities, because we want this hip replacement to last, hopefully, for the rest of their life. And so I ask them to try to keep a normal weight, or if they're heavy, to lose weight so it takes some stress off the hip replacement. And I want them to exercise. We want them to walk, swim, bike, play golf. So we want them to be physically fit and active. But running, jumping, and impact activities where basically they're pounding on the hip, we discourage that.